Hello friends, welcome to Physiology Matters. Today we will discuss heart sounds. This is one of the most important topic in cardiovascular physiology. This is basically a short answer question, but part of it can be asked in BAQ or the whole of the topic can be asked in uh, LAQ as a part of the LAQ. So let's begin this topic. I have prepared this table where I will describe first, second, third and fourth heart sound. That is all the four heart sounds in single table. I have prepared 12 points for this individual heart sounds. If you will remember these points, you can write answer of these questions. So let's see these different types of the heart sounds. So first we will see cause. So first, second, third and fourth heart sounds. So out of these four heart sounds, first and second heart sound, they are audible with diaphragm of the stethoscope, and the rest, third and fourth heart sound, are not clinically that much audible in normal individuals. So this first heart sound, its cause is closure of AV valves, that is atrioventricular valve closure. Now when is this closure of AV valve? It is during the initiation of ventricular systole. So this is heart and this is the atrioventricular, this is the mitral valve and tricuspid valve. Okay. So during the starting of the systole, these valves close. So while closing, they make a sound. So this sound is nothing but due to the vibration of the heart valves or their cusps. Okay. So first heart sound causes closure of AV valves, that is due to the vibration of the heart valves, and it marks the initiation of ventricular systole. Then second heart sound, it is due to the closure of semilunar valves. Now this pulmonary and aortic valve. Okay, so it is during end of the systole phase or starting of the diastole phase. So it marks the initiation of ventricular diastole, or in some books it is given that it is at the end of the systole. Okay. Then the third heart sound, it is due to the sudden ventricular filling after AV valve opening. So basically the first and second heart sound, they occur during the systolic phase, that is starting of the systole and end of the systole. And third and fourth heart sounds, they occur during the diastolic phase. So the third heart sound, it occurs during the middle of the diastole, and fourth, it is during the last filling phase. Last filling phase due to atrial contraction. Fourth one, atrial contraction. So third heart sound, sudden ventricular filling after AV valve opening, and it is heard just after the second heart sound, and it is at the beginning of the ventricular filling phase, that is the diastole. And fourth heart sound, it is heard during ventricular filling after atrial contraction, and it is heard before first heart sound during the last rapid filling phase of the cardiac cycle. So during the systole, the atrioventricular valves close. Okay, that is the first heart sound. At the end of the systole, the semilunar valves, that is aortic and pulmonary valve, they close. Okay, they close due to the pressure in the aorta and pulmonary artery. It increases as compared to the ventricles. Okay, so there is closure of the semilunar valves, so that is the second heart sound. And after that there is opening of the atrioventricular valves. Okay, that is the third heart sound. And the fourth heart sound is just before the first heart sound, that is the atrial contraction, during which blood it comes from atria into the ventricles. Now what is the quality of these sounds or characteristics? First heart sound, it is loud, low pitch, dull and prolonged, that is of longer duration. Second heart sound is sharp, high pitch, that is high frequency, and it is of shorter duration. First heart sound, it mimics or it is heard like lub. In some book lub it is also given lub, and duration is 0.1 to 0.17 seconds. Okay, and it is of longer duration. And this dub, it is shorter one. In some books dub is also given, and it is 0.1 to 0.14 seconds. Okay, and this third heart sound, it is soft, low pitch and dull. Okay, and its duration is 0.04 second. And this fourth heart sound, it is low pitch and it is having very low frequency. It is very low frequency sound. It is very low frequency sound. Okay, so this is about quality of the sound. Now method of detection. In general, clinically we use stethoscope for detection of or listening to the sounds. For first and second heart sound, we use diaphragm of the stethoscope. Okay, for first and second we use diaphragm. And for listening third and fourth heart sound, we use bell of the stethoscope, and we put patient in left lateral position. Okay, these heart sounds can be recorded graphically also. This is called as the phonocardiogram. This is called as phonocardiogram. Phonocardiogram. So this is the record. This is the record. And phonocardiograph is a machine, and phonocardiography is the recording procedure. Okay, so this is how to record it. So most commonly stethoscope is used for listening these sounds. First and second heart sound are audible, third and fourth are not audible in normal condition. In abnormal condition you may heard it, but with the help of the bell of the stethoscope. Then this first heart sound, it is best heard at, so there are four basic areas: mitral area, tricuspid area, pulmonary area and aortic area. So first heart sound is heard at all the four areas, but it is best heard at mitral and tricuspid area. Second heart sound is heard at all the four areas, but it is best heard at pulmonary and aortic area. Third heart sound, it is heard at apex in left lateral position. Also fourth heart sound is also heard at apex in left lateral position. Okay, then the next point is ECG, electrocardiogram. In ECG, so this is okay, so this is P wave, this is QRS complex, and this is T wave. So first heart sound is heard at the peak of the R wave. Second heart sound is heard at the end of the T wave. Third heart sound is heard after T wave, and the fourth heart sound is heard during the P wave. That is the atrial contraction. This P wave, atrial contraction. Okay. Now the carotid artery pulsation. Next point is carotid artery pulsation. So most important thing is first heart sound, it coincides with the carotid artery pulsation. So when you will auscultate, and there are two sounds, okay, lub dub. So the sound which is coinciding with the carotid artery pulsation, you can take carotid artery pulsation simultaneously. The sound which is coinciding with the carotid artery pulsation is first heart sound. This is method of identification for first heart sound. Second heart sound, it follows carotid artery pulsation. After second heart sound, third heart sound is there, and before the carotid artery pulsation, just before it, fourth heart sound can be heard. Okay. Then JVP, jugular venous pulse. Okay. First heart sound, it is heard just before the onset of C wave. Second heart sound, it coincides with notch of the ascending limb of V wave. Third heart sound, it is heard at end of the descending limb of the V wave. And fourth heart sound, it coincides with the rise of A wave, that is atrial contraction. Then in which abnormal condition you will get abnormal heart sound? So first heart sound you will get abnormal, that is abnormal first heart sound you will get in cardiac hypertrophy, incompetent atrioventricular walls. So basically first heart sound, it is produced by closure of the atrioventricular wall. So any abnormality related to the atrioventricular wall will cause abnormal first heart sound, and any abnormality related to the aortic and pulmonary walls can cause abnormal second heart sound. Okay. So first heart sound, abnormal first heart sound you will get in cardiac hypertrophy and incompetent atrioventricular wall. And second heart sound, abnormal second heart sound you will get in aortic or pulmonary regurgitation. So there are two terms, number one stenosis and number two regurgitation. What is stenosis? Here the heart walls, they will get adhered to one another, or there is hardening of the walls, due to which the blood, it will not pass easily through these walls when they are closed. So that is called as the stenosis. And what is regurgitation? So there is scarring of these walls, okay, scarring of this wall, and when the walls are in close position, but it will not close completely, and there will be backflow of the blood. Okay. So due to this there will be regurgitation. So that is called as the regurgitation. So stenosis and regurgitation. So aortic wall regurgitation, pulmonary walls regurgitation. In this condition you will get abnormal second heart sound. Now third heart sound, it is abnormal in left ventricular failure, in mitral regurgitation. Fourth heart sound, it is abnormal in hypertrophic cardiomyopathy, basically in left ventricular hypertrophy, and in aortic stenosis. In both of these condition the fourth heart sound will be abnormal. Then other important features related to individual heart sound. The first heart sound, it will coincide with the apex beat. Second heart sound, it is having two components, aortic and pulmonary. So both the aortic and pulmonary walls, they don't close at the same point or same time. So there is a minute gap in between the closure of aortic and pulmonary walls. Okay, so that's why second heart sound is having two components, aortic component and pulmonary component. But in some of the diseases, some of the condition, the aortic and pulmonary component time gap, it will increase, okay, or decrease. So these pathologies can affect the second heart sound. Okay, then the third heart sound, it is heard just after the second sound, we had seen this. And fourth heart sound, it is also called as the atrial heart sound. Okay, so these are important characteristics of first, second, third and fourth heart sounds. Then the next topic is murmur. Okay, so what is this murmur? It is nothing but abnormal heart sound. Okay, what is the cause or reason for murmur? It is due to rapid turbulent blood flow through heart. Okay, so this is the cause. Okay, and this is the definition. Abnormal heart sound is murmur, and it is due to rapid turbulent blood flow through heart. Now there are basically three types of the murmur. One is systolic, during systole. Second one is diastolic, during diastole. And third one is continuous. Out of these, systolic and diastolic, these are important, and you should know the conditions or pathologies related to these systolic and diastolic murmurs. Now systolic murmur, it is heard in aortic stenosis and mitral regurgitation. These are two conditions where you will heard systolic murmur, that is murmur or abnormal heart sound during systole. And diastolic murmur you will heard during aortic regurgitation and mitral stenosis. So diastolic murmur you will heard during aortic regurgitation and mitral stenosis. Okay, so these are the examples where you will get murmur, and these are the types: systolic, diastolic. Systolic during aortic stenosis, mitral regurgitation; diastolic during aortic regurgitation and mitral stenosis. Okay, so this is all about the heart sounds. So you should know individual characteristics of first, second, third and fourth heart sound, and you should know about the murmur. Now in LAQ, describe heart sounds. This can be one of the component of the long answer question, or separate short answer question can be asked on heart sound. Describe heart sound, where you will need to describe first, second, third and fourth heart sound, and whether it is asked or not, write these important points about the murmur, because it is one of the part of the heart sounds. Or BAQ can be asked, separate BAQ can be asked on first heart sound or second heart sound, or both first and second heart sound, or describe third and fourth heart sound. Okay, so these can be the questions. Also multiple choice question, that is MCQ, can also be framed on this related to the this information. Okay, so this topic is very much important regarding LAQ, SAQ, BAQ or MCQ. Okay, so thank you for watching this video. In next video we will see another topic from cardiovascular physiology. So thanks for watching Physiology Matters.